Last spring, as data from the U.S. showed the startling disparities in the ways COVID-19 was killing and infecting Black and Brown Americans, Black health leads and experts here in Canada, a country that doesn't collect race-based data, rang the alarm. Dr. Upton Allen was one of them, and that advocacy led to change.
It's before and after data that will allow us to see if the improvements or supports that we put in place are going to be beneficial.
Together with community partners, Dr. Upton Allen, head of infectious diseases at SickKids Hospital, launched a pilot project to research and better understand how and why Black Ontarians were getting infected by COVID-19 at higher rates.
There's that initial interest because of my field in infectious diseases. And then on top of that, it so happens that I, as a Black infectious disease specialist, really represent a handful of such specialists across the country.
Dr. Allen knew representation was key, and it was important to not only lend his voice, but his time and work. He did it again recently as the City of Toronto launched the Black Scientist Task Force, in part addressing vaccine hesitancy.
The hesitancy is not confined to racial lines. That said, it became apparent to me as I was interacting with the Black community, the hesitancy was based on wrong information.
Dr. Allen says other communities were also experiencing vaccine hesitancy, so he shifted gears once again to inform.
The goal is basically to provide information, provide correct information, not to twist anyone's arm to be vaccinated.
Let's say a year passes and you look back and you reflect on COVID. What will you be most proud of when it comes to your work?
As a doctor, at the end of the day, you really want to save lives. You want to ensure that you improve the quality of people's lives. I would really be extremely pleased if at the end of the day, I can say that the members of the Black community participated in an effort to generate information that relates to them and that they were a part of that process.
Dr. Allen also adds that he hopes this work will benefit Black and racialized communities in ways that address mistrust, as well as systemic and structural barriers these communities often face. At Toronto's SickKids Hospital, I'm Faiza Amin for City News.